In this video, we're going to cover everything you need to know about clitoris reduction. Hi, my name is Dr. Slave Gallagher. I'm a plastic and reconstructive surgeon based here in Miami, Florida, and I'm one of the few practices in the United States that offers this procedure. We're going to talk about what exactly is it, why patients seek it out, what surgery looks like, what recovery looks like, and importantly, what orgasms and sensation are like after surgery. So let's get into it. So how do we know if the clitoris is too big? Well, the only person who can really answer that question is the owner of the clitoris itself. Oftentimes, patients will describe to me that they don't like the appearance of it, the way it shows too much, or it reminds them of having a small penis. And one thing that's a dead giveaway that clitoromegaly is going on is that when they get aroused, it gets a lot bigger. So that would tell you it's not necessarily the labia that's causing the issue, but if it gets much bigger on arousal, that's erectile tissue, and it's probably an issue with the clitoris itself. How big should a clitoris be? Well, during the 70s, they looked at 400 folks assigned female birth and did some measurements. And they found that when they measured the height of the little glands, the little bit you can see, the little head of the clitoris, and multiplied it by the width, the vast majority of women had that surface area was less than 35 millimeters squared, the average being about 18. So typically that means that the width of the glands itself is kind of less than 5 millimeters and the height less than 3. There's other ways to measure it as well. For example, the total length of the clitoris itself is usually around 10, including the glands. Depending on which study you look at. So those are the known numbers, but like I said, it really depends on the patient herself. And the things that can upset patients is, number one, most typically would be the appearance, especially the appearance on arousal, but other patients can notice things like irritation and the fact that it's exposed, it's rubbing off things and causing unwanted stimulation and that sort of thing. So why does this happen? Why may some girls complain of this issue? I would say the most common reason is what we call idiopathic. It's just how their anatomy is how they were born. In some patients we see where they have hormonal conditions such as polycystic ovarian syndrome, their testosterone may run high. This can cause the clitoris to get larger. Patients who've needed long-time steroids, sometimes we see that for various different illnesses, or more commonly patients who've used anabolic steroids, let's say for fitness and bodybuilding in the past. And unfortunately, many girls who've used these in the past will tell me that even though it was a short duration, they notice quite a bit of growth, and in many cases, whereas it does somewhat shrink down after those steroids or hormones are stopped, that a lot of that residual growth will remain. If a patient has been using these medications, I always advise them to give their body a chance, see if things go down. But in general, as a general rule, there's no great way to shrink a clitoris that's too big. Only by stopping these things, we can stop it from continuing to grow. But in many cases, I see the size remains that big. So there's only one way to reduce it down, and that's going to be surgery. So for patients who want a clitoris reduction, choosing the right surgeon is super important. Time and time again, I see patients who've gotten 1, 2, even 3 labiaplasties elsewhere, which wasn't correcting the issue. The issue was the clitoris itself is too big, and labiaplasty just gets rid of the tissue around the clitoris. Oftentimes what's called a clitoral hood reduction will be included in a labiaplasty, but again, that's not reducing the erectile tissue of the clitoris itself, and can actually unhood the clitoris, make it more obvious, and make things a little bit worse. So first of all, you need to find a specialist and clarify with your plastic surgeon that we're doing a clitoris reduction. I often say it's useful to look at diagrams, look at pictures with your surgeon to make sure you're both on the same page. Typically, as part of a clitoris reduction, I'm adding in a labiaplasty. I'm also usually adding in a clitoral HUD reduction. Depending on the patient's anatomy, that's usually part of it, because what we're going to want to do is reduce down the size of the erectile tissue. So we usually lift up the clitoris, tuck it back in. Once we get rid of that erectile tissue, we're going to usually decrease the size of the head of the clitoris down to typically a normal size, depending on the patient's preferences. And we have to make the tissues around it pretty, so that's where our labiaplasty and our clitoral HUD reduction come in. This is a very delicate surgery because in order to get rid of that erectile tissue, we have to lift back the head of the clitoris and the nerves, which are super important to preserve, obviously. In order to expose, here in blue we have that erectile tissue. That's what we're going to remove, and we're going to preserve the nerves. This procedure usually takes me 2 to 3 hours. We do it under magnification. It's a slow procedure because we're being super careful with those all-important nerves. So here in Miami, we have patients who fly in from all over the world for this surgery. Usually I recommend about 7 days here with us in Miami. Surgery itself, like I mentioned, takes about 2 to 3 hours. We do it under general anesthetic. You go to sleep completely for it. And every patient's surgery is going to be a little bit different depending on her anatomy and how much of a labiaplasty we need to do, how much of a clitoral reduction, but that's all included. You go to sleep completely for your surgery. The stitches are all dissolvable. We numb things up really well down below, and surprisingly the pain isn't that bad. Probably about half of my patients don't have to take any narcotic medications. They just take Tylenol, ibuprofen, medicines like that. The swelling after any sort of general surgery is always a lot. So I always warn patients that you're not going to see your final result for several weeks, and in some patients, depending on the swelling, it can even be months afterwards. Typically, downtime for this surgery is about 1 to 2 weeks off work. Certain activities, such as riding a bike or sexual activity, is out usually for about 4 weeks after this surgery. But overall, most patients tell me it's not a very painful surgery and they get back about their activities fairly quickly. With the modern technique of clitoris reduction, the most important thing I'm doing when I go in there is visualizing the all-important nerves to the clitoris and preserving them. So we go really slow and careful underneath magnification. Now, having said that, it's sometimes different, the sexual experience after this surgery. The vast majority of patients tell me that their sexual experience is actually improved after the surgery, and that's because, as we always say, the most important sexual organ is up here. It's the brain. So when patients are less self-conscious, they tend to relax more during sex and enjoy it more. However, typically most patients won't return to sexual activity for about 4 weeks. And usually there can be a little bit of a learning curve in getting used to the new anatomy because the clitoris isn't as obvious as it was before. However, having said that, all the same nerves will be still there, so pleasure in the long run should not be diminished, and patients do return to having orgasms, but just depending on how they're feeling after surgery, swelling, things like that, it definitely takes a few weeks in most cases before patients do that. I always encourage patients to explore things on their own first before maybe with a partner, see what feels good, and there is, like I said, a little bit of a learning curve in relearning that anatomy after any sort of genital surgery. We see that, but overall orgasm sensation after surgery tends to be excellent.